The local health and care organisations in Guildford and Waverley are working together to improve care in our area. Through the Better Care Together programme, we plan to review urgent care services across Guildford and Waverley to identify improvements we can make to meet the changing needs of our population. This short film explains why we think our current services need to change and how we plan to go about it. Urgent care can be defined as medical care that is provided for illnesses and injuries that require prompt attention but are not life-threatening. This care is accessible via NHS 111, your own doctor's surgery, and GP extended access. These are appointments in nearby GP practices, primary care out-of-hours services, local pharmacies, and non-emergency walk-in facilities such as walk-in centres, minor injuries units, and urgent treatment centres. Locally, people can also access same-day care in CYP Haven Guildford and CYP Haven. Like most places in the country, our local health and care services are under pressure and people sometimes struggle to access the care they need when they need it. Nationally, the over-reliance on emergency and urgent care services is at risk of becoming unmanageable, and most areas are now looking at ways to change and improve these services. In Guildford and Waverley, we have identified 4 main reasons why we need to change: declining accident and emergency performance, difficulties recruiting key staff, our growing and ageing population, and finally, meeting national requirements for urgent treatment centres. NHS England has recently published a national specification that describes how urgent treatment centres need to be organised. Urgent treatment centres are GP-led services that are open at least 12 hours a day, 7 days a week, and able to diagnose and deal with many of the most common ailments seen in A&E. Appointments must be available as part of a walk-in service or booked on the day via NHS 111. Urgent treatment centres are ideally co-located with primary care facilities, including GP extended hours, GP access hubs, or integrated urgent care clinical assessment services, formerly known as GP out-of-hours services. Treated conditions must include minor illnesses and injury in adults and children of any age, including wound closure, removal of superficial foreign bodies, and the management of minor head and eye injuries. And all urgent treatment centres should have access to investigations including pregnancy tests and urine tests. Other tests should include blood testing, electrocardiograms, and wherever possible, simple X-ray facilities. We need to consider whether an urgent treatment centre is needed to meet the needs of people in Guildford, Waverley, and surrounding areas, and if so, where it should be located. Through the Better Care Together programme, we aim to deliver an urgent care service that is able to meet the needs of our changing population. Improved understanding of what these services are and how they can be accessed. An urgent care system that's attractive for staff to work in. Consistently high quality services. Improved outcomes for our patients. A reduced demand for urgent care services at our local A&E department, and urgent care services that represent good value for money. We know from the NHS England guidance and urgent treatment centres that minor injuries units and walk-in centres cannot continue to operate in their current form. We don't yet know what our local urgent care system will look like. We need your input to help us shape this. However, in keeping with our commitment to out-of-hospital services, we do expect that our new model of care will include primary care, community pharmacists, ambulance and other community-based services providing a locally accessible and convenient urgent care service for patients and an alternative to A&E. As our ideas develop, we need views, opinions and suggestions from local people, health and care staff, patients and carer groups, local politicians and partners in the business, community and voluntary sector. Now is the time to tell us what is important to you when it comes to urgent care. We will publish the results of this initial engagement so local people have the opportunity to read and understand what others have said. Our clinicians will then use this information to work with partners to develop more detailed proposals. We'll test all our proposals against formal evaluation criteria that will assess whether the proposals are affordable and whether we're likely to be able to recruit the staff we need. And importantly, we'll also consider the potential impact of these proposals on other parts of the health and care system, as well as on equality of access for patients. Our proposals may or may not require formal public consultation, depending on the level of change proposed. But whatever changes we may propose, we are committed to ensuring that the public and other stakeholders are fully involved and informed every step of the way. We will be out and about in July and August to talk to people about urgent care and what's important to them. Look out for our banner and come to talk to us. Details of where to find us will be published on our website www.guildfordandwaverleyccg.nhs.uk. In September 2019, we're running a series of engagement workshops across Guildford and Waverley at different times of the day and evening. Further information about the programme and all events details can be found on our website. We hope to talk to you over the coming weeks, but if you are unable to come to one of our events, you can still share your opinions with us by completing a short survey. Details will be shared on our website and with all our partners and stakeholders. Emailing us at gwccg.info@nhs.net. Phoning us on 01483 405 468. SMS texting us via 07917 087 560 or writing to us at Free Post NHS G&W CCG. Thank you for watching. We're really looking forward to hearing your views on urgent care in Guildford and Waverley.